Welcome back to Long COVID Doctor, an educational series for all of those of you who still have long COVID. I'm Dr. Tim Robinson, formerly a family doctor at GP for 30 years, and now working in Long COVID Services for 5 years. I post on all the usual podcast channels as well as on YouTube. Hope you find them helpful, and if you do, obviously click subscribe and share these posts with anyone that you know who also has long COVID. Let's get this information out there, a trusted resource. Thank you. So, thanks for all the feedback you're sending in, the comments and the inquiries, etc. I apologize. I just haven't got the time to reply to them all. I read them. I appreciate them. Just keep them coming. But they, like I said, I apologize for not responding to those queries and comments. They do help me with my future postings. So, like I said, please keep them coming. Another apology, my usual disclaimer. It's important though. Any advice or treatment that I mention in these postings should only be considered after you've talked to your own doctor. So, this talk is on taste and swallow problems that occur in long COVID. And I will cover the symptoms, what the patients are telling us in our clinics, and the causes behind those taste and smell problems, and then the treatments and strategies that can help with those problems. So here we go. Taste and smell problems in long COVID. It has to be said that actually they're not that common now, and perhaps they're just underreported because they're overshadowed by the more serious, more troublesome symptoms such as fatigue and brain fog and pain and headache and all those type of long COVID symptoms. However, if you've got them, it's just another symptom that you're having to contend with and add to your overall long COVID symptom burden. So wouldn't it be nice if we can do something about it? What are patients actually telling us? What are they actually experiencing? Well, smell problems can be either a complete loss of the sense of smell or partial loss. So that's anosmia or hyposmia. Some patients are saying that the sense of smell is distorted. The smells are distorted. So a cup of coffee doesn't smell like a cup of coffee anymore. It can smell something pretty hideous, horrible, rank, such as, sewage, whatever. We've heard this in these clinics. So we call this parosmia or cacosmia. Smelling things like smoke or petrol, again, is another common presentation in patients with smell problems, and that's phantosmia. That's smelling smells that actually there's no presence of smoke or petrol, but they can actually smell them as if they are there. And then conversely, so those are all smells that are unpleasant or abnormal. There are some patients who are actually saying that they can detect smells that are really pleasant. So they're the lucky ones, if you like. And I wish that all patients who had smell problems were finding them pleasant, etc. But that's not the case. So taste problems. Taste problems, again, can be either complete loss of taste or partial loss of taste. So that's ageusia or hypogeusia. So disturbed sense of taste. So again, that could be something called sort of a parageusia or dysgeusia, where, you have an unpleasant or metallic taste in your mouth, where food tastes bland and bitter or rotten even. So those are the sort of the symptoms that our patients are telling us. They may be on their own, so individually, only taste problems or only smell problems, or indeed combined. So combined taste and smell problems. And that's not surprising because both taste and smell share a number of different areas in the brain where taste and smell is processed and brought to our consciousness. So I'll explain that in a minute. However, whatever, whether it's taste or smell or both, and however it's presenting it to itself, it has an impact on quality of life. So people can't enjoy, say, the taste from eating from their food. So the seasoning and the herbs and the spices and things are no longer picked up and appreciated, which is something that's taken away from you. You can't enjoy pleasant sort of smells, aromas, scents. The scent, your favorite perfume, etc., or the smell of, freshly baked bread. If that was taken away from me, I would feel really a bit disappointed. But also, patients who are troubled with unpleasant smells, they sense this a disgusting smell, etc. That is really has quite an impact on your everyday quality of life. And indeed, some patients actually say these smells can actually make them feel queasy, sick, nauseated. It's not what you want. So let's get into why long COVID people have abnormal taste and smell problems. Well, in order to do that, I think it's probably really helpful to understand what goes to make up normal taste and smell. What are the pathways? What are the neurological sort of pathways that bring about that sense of taste, sense of smell? Let's look at them in turn. First of all, taste. So the gustatory pathway is known as. So take something into your mouth and it has a taste, and your taste buds pick them up. And basically, taste buds are collections of receptors, chemical receptors on your tongue, and they are linked up with nerve fibers, which then take nerve impulses up what's known as the cranial nerves. That's the 7th, 9th, and 10th cranial nerves to the brainstem, and then onto the brain taste center, which is located in the limbic system, deep in the heart of the brain, and in particular, the hippocampus. Hippocampus is where short-term memories are laid down. In the hippocampus, those nerve impulses that are stimulated link up memories and associations with those individual tastes. And then they are brought to our consciousness. And so you can become aware of tastes in the mouth. So it's the taste of our gustatory pathway. What about the smell pathway? So the olfactory pathway. Well, same principle really. Smells, aromas are basically chemicals that are circulating around the airspace, and then they're inhaled through the nose, and lining the nose are receptors, smell receptors, which are linked to a nerve called the olfactory nerve. The olfactory nerve sends impulses up into the brain, into the cranium, into the skull cavity, and that olfactory nerve goes to something called the olfactory bulb, and then further on into the brain smell center in the limbic system, also in the hippocampus. Again, these impulses link up memories and associations with individual smells and bring them to our consciousness. So that's the sort of, if you like, the neurology and the anatomy and the explanation of how a smell or a taste as a chemical gets to be registered in our consciousness as a smell or a taste. So what causes those smell and taste problems? Well, as both smell and taste pathways are complex and complicated, damage of those pathways at any point in the pathway can result in taste and smell problems. So basically, there are a couple of mechanisms at play in this long COVID context that can bring about the damage in those pathways. It could be damage of the actual taste and smell receptor cells themselves, i.e. in the lining of the nose or in the taste buds on the tongue. Damage there is going to cause a problem with, you're not going to pick up those nerve impulses, and that then should go all the way to the taste and smell centers. No. So it's a problem right at the start. Or it might be something to do with inflammation of the nerve that picks up those impulses, but the nerve being inflamed doesn't work properly. And that could be because of overactive immune systems within the brain, the microglial cells, or it could be damage of those nerve pathways anywhere along that journey to the taste and smell centers. The damage could be inflicted by the virus directly itself, or as a result of what we call synaptic pruning, where the nerve fibers at their connections are affected, or microthrombi, microclots, mini clots, can block the blood supply to those nerves, and then because without any blood supply, they haven't got any oxygen. Therefore, those nerve fibers can die. Autoantibody problems, inactivation of what's known as an oligodendrocyte, which is another cell in the brain tissue, which is responsible for laying down of the myelin sheath, which its function is to make nerve impulses to pass very fast down nerve fibers. So damage in any of those parts of the whole pathway can result in taste and smell problems. And finally, the taste and smell centers themselves in the limbic system and the hippocampus can be affected directly by any of those long COVID processes. So, as I said, this whole taste and smell pathways are extremely complicated and complex, and we probably don't really understand them fully. However, damage can occur, like I said, in any part of that pathway, and resulting in the taste and smell problems. So what do you do if you have a taste and smell problem with your long COVID? Well, as you will have gathered from previous other postings, it's a matter of taking it one step at a time. Any new problem you've got to take to your doctor to be assessed in order to get a diagnosis and some guidance and maybe some treatment. Maybe a hospital specialist opinion may be needed. But in reality, problems with taste and smell really, are very straightforward. You've either got a problem with your taste and smell or you're not. There's no real fine case history needs to be explored because it is what it is. Following on from the history, the case history, it's a matter of an examination. Again, in this context with taste and smell problems, really physical examination doesn't really reveal much. The doctor, the GP, may look in your mouth or up your nose, but actually there's really very little to find. Blood tests, likewise, you'll probably have the long COVID blood test panel looking at, your full blood count and your kidney function, liver function, thyroid and diabetic, as well as inflammatory markers. But actually there are no specific blood tests that are indicated for someone who has taste and smell problems. And finally, red flags. Well, again, doesn't really apply in this case of long COVID smell and taste problems. If you've got it, they may be part of a bigger neurological problem, which in a way will have raised its own red flags. So what can be done about taste and smell problems? Let's think about taste problems first of all. Patients are really keen to have this addressed because it actually brings quite an impact to the quality of their life. And so they'll try anything, as I would, to try and improve my loss of taste or reduce taste or abnormal taste, take those abnormal tastes that I was describing away. So what do we all do when we've got a problem? Before going to the doctor, you probably look online, don't you, and Google search taste problems in long COVID or taste problems of their own. Well, the list is long. If you look up that, if you Google that, the list is long. I have to say that a lot of the suggestions I think are either common sense, but probably not very helpful. Artificial saliva spray you can get, something called glandusane, which is said to help. I don't see why it should. Change in medication. Some medications do have taste problems as one of their side effects, but again, they're pretty rare. And I think changing medication, blaming your medication on your taste problems is probably not going to be very helpful. So I don't think there's much mileage in that either. Zinc supplementation, that comes up quite often. If you Google taste problems, actually, I don't really see the science in that. I know that zinc is an antioxidant, and zinc is, of course, important. It's a trace element. It's important for lots of functions in the metabolism within cells. However, I don't see how zinc supplementation is going to improve your taste problems. What can be done about those taste problems? Well, again, it's sort of common sense. You could spice your food up, add more spices, more seasoning, and flavor enhancers, say. But I don't think that it's going to make much of a difference. But it's certainly worth trying. Avoiding bitter foods is said to be helpful. Serving food cold, which I don't think would impress me too much. However, it's on the list of helpful suggestions, so-called helpful suggestions. Regular mouthwashing, again, I'm not too sure that that's going to make much of a difference, but it's on the list of things you can try. Like anything, it's worth giving it a try. If it restores your sense of taste, it was worth trying, because that's something you're going to want to continue with. But actually, if you've tried any of these strategies and they've not made a difference after a couple of days, I'd give them up. What about smell problems? What can we do about that? Well, essentially, the only thing you can really try is something called smell training. That is actually evidence-based. Studies have been shown that smell training can improve your sense of smell. It's not a guarantee, but again, like I said about the taste experiments, experimenting with different strategies and what have you, it's worth a try. So you can get these kits from trusted organizations, and you can look them up online, on the web, their websites. So there are two that I've looked at and I actually think are sensible and responsible and have done the research to back up their claims. So the first is something called Fifth Sense. That's fifth, as in 5 cents, fifthsense.org.uk. And the other is absent.org. So absent, as in AB cent, SCENT.org. Again, is a trustworthy website resource for you. They offer you kits, which you have to buy, which contain sort of smells in bottles, so tinctures, if you like, of rose, lemon, eucalyptus, and cloves. And what they advise is to smell these individual 4 different smells twice a day for 20 seconds, and keep it going for 12 weeks. Hopefully, by the end of that, your sense of smell will be restored. Whilst you're sniffing these individual 4 bottles, basically you should they say that you should imagine what those smells conjure up, or imagine, say, the lemon one, imagine the smell of lemon, sort of get a mental picture in your mind of lemon, to actually reinforce that smell, that hopefully it sort of wakens up those pathways. What else can be tried, or what else is online? What else you might find when you Google it? Well, you will probably find one of the suggestions being inhaled nasal steroids, such as Beckinase. The type of inhaled nasal steroids that are used for hay fever or allergic rhinitis. Well, they're very effective for those conditions, but I'm not too sure whether they're going to restore your sense of smell. I don't know if there are any studies that prove that those nasal steroids are effective. Again, like I said before, you can buy these nasal steroids over the counter, so some people will experiment with them, and there's no harm in that. If they are effective, then you've done yourself a favor and your sense of smell has returned. Wouldn't that be lovely? However, don't raise your hopes too high, is what I'd say. Another nasal inhaler that is recommended often in these Google searches for helping smell problems is inhaled saline nasal sprays. There's one called Sterimar, which you may come across. Again, I don't think you're going to come to any harm by using this, but I can't really see a reason for it to improve your sense of smell, especially now that you know the anatomy and the processes that have resulted in your loss of smell. You probably understand and see that actually a nasal spray inhaled up the nose probably is not going to address most of the problems that have led to your loss of smell. So, basically recovering from taste and smell problems, it does actually come down to time and natural healing and repair of the damage that has occurred that has resulted in your taste and smell problems. So, repair of the lining cells of your nose or the taste buds that have been affected by the acute COVID infection, repair of those nerve pathways as they run through the brain, or indeed repair of those brain centers that have been affected. So this happens as part of natural healing. So new nerves do grow. We know about this. Neuroplasticity, neuroplastic healing brings about the sort of reconnection of nerve fibers, and that's well documented and recognized and demonstrated. Blood clots that might have blocked those blood vessels that serve those nerves, sooner or later will be dissolved naturally, and the process of recanalization will take place. And if that doesn't happen, then there's a process called neovascularization. New blood vessels are created that bypass those blockages. So the blood supply is reestablished to that area, and hence gives a chance for the nerve to recover or be replaced by new nerves. Inflammation of long COVID, again, it takes time to settle, but it can settle with time. So there we are. That's smell and taste problems in long COVID. Bringing it all together now as a sort of summary. Right from the start, taste and swallow problems were a hallmark of the acute COVID virus infection. It was one of the diagnostic criteria which alerted us to the diagnosis of an acute COVID infection. And most people's acute COVID symptoms, such as fatigue or nasal congestion, as well as loss of taste and smell, resolved. But those of you with long COVID, you weren't so lucky, and your symptoms didn't resolve. And that includes, for a percentage of you, your taste and smell did not return, and under now still ongoing as part of your COVID long COVID package. As I said earlier, taste and smell problems really are not that common in our long COVID patients now. I saw them more frequently in the early days, sort of 2-3 years ago, but they're less of a problem now. As I said earlier, maybe it's because they're just not reported, and because taste and smell people just sort of put up with, and they're more troubled by those other long COVID symptoms, such as the fatigue and brain fog and pain, etc. So therefore, they're maybe, like I said, overlooked and not reported. Whatever the cause, like anything, you've got to see a doctor to get the diagnosis, guidance and treatment, if possible. But actually, with smell problems, lack of smell or strange smells, really the only thing you can do is smell training. For taste problems, the only realistic thing that can make a difference are dietary tips, such as, spicing up your food or seasoning it or sort of adding flavorings. The real remedy, like I said, is time and natural healing to address those underlying causes that have culminated in this taste and smell problem. And acceptance, of course, accepting that you've got this problem, you've accepted that, you've got long COVID and it's harsh, but you are one of the unlucky ones. And, it's a case of accepting it and coming to terms with that. And that in itself will reduce, distress and frustrations. And indeed, it will actually add to the healing process by, being accepted and not fighting your long COVID, will lead to sort of and aid that recovery through that natural healing, and aided by other lifestyle measures when attending to one's nutrition and sleep and reducing stress and those sort of factors that will enhance and optimize your immune response and general sort of healing processes. So there we are. That's it. My update on taste and smell problems in long COVID. I hope you found that helpful. Like I said at the start, this is an educational series for those of you long COVID sufferers who are still suffering. I hope that advice has been helpful, but remember my usual disclaimer: all this advice and treatments, but in this situation. There aren't very many treatments, but advice I've given, obviously don't consider them unless you've thought about it and talked to your doctor about them. Remember, safety first. So, as I said, I hope this has been helpful. So if you have found them helpful, obviously click subscribe, spread the word, tell anyone else that who also has long COVID, and especially if they've got taste and smell problems, get them to tune into this one. Again, thanks for the feedback that you send me. Apologies, no replies. Again, it's a time problem. So in the meantime, I wish you well with your long COVID recovery, and until the next posting, all the best. Cheerio. Bye-bye.